who would have ever thought we would have been in a pandemic and have to deal with what we've had to deal with. And I just really appreciate the community, because with leadership like Councilmember Dunn and others here and the support that we've had, our community has done so much better than other communities. When you take a look at what's been going on in Florida, in Arizona, down in Texas, and in California, I knock on wood, as Councilmember knows every time I say this, but it's a testament to our community and to the support with public health that we've all hung together. We all see the light at the end of the tunnel here, but we are more at just after halftime. If I can use a sports analogy here, we've made it through the first half, and now we're in the second half, and we can see the end and the win here. We just have to all stick together. So I want to just briefly give some statistics, but let me start as I chat with folks who may not have heard me say this before, is what makes a pandemic something different? In the very beginning, there was a lot of conversation around, was it like the flu? What was it like? Well, there are three things that make a pandemic unique. And I think this is important for all your constituents to know. First, it's what's called a novel virus. It's a virus that our bodies have never experienced. And so what that means is that, number one, we don't have a lot of science to know and guide us. And in the beginning, we certainly saw that, and you've seen it evolve over time. And secondly, it means that you are watching science live time. Our guidance changes as we learn new things about the virus. We didn't know the effectiveness of masks at the very beginning, but now we do. We have the evidence to show that when you're out and you wear a mask, you're protecting yourself, you're protecting your neighbor and your community. So that's the first thing. The second thing is a pandemic and a novel virus means we don't have automatic treatments. And you've seen the discussion and the emergence of treatments. One that you probably haven't heard about is in the very beginning, we used a lot more ventilators and putting people on breathing machines. And now doctors know that if you turn somebody and put them on their stomach and give them oxygen, you might be able to avoid that very traumatic experience of having a ventilator. So treatments are not just about drugs, it's about how your wonderful healthcare providers on the front line are using the science to develop what they learn lifetime to help save lives. And then thirdly, the one piece that we know has been partially solved is we now have a vaccine. A novel virus means there's no vaccine for it, and they have worked at lightning speed, but they've used the rigorous testing that all new vaccines go through to show effectiveness and safety. And we now have vaccines, too, that are 95% effective, which is astounding for a brand new vaccine. I'm so proud of our scientists and our researchers at the University of Washington and other places for coming up with such a wonderful gift to our community. And we're actually expecting more vaccines to potentially come on the market. But right now we have two, and I'll talk more about that. So I wanted to start with that, and let me share my screen here to quickly show you, as of today, where we're at with our outbreak. So this is called the 7-day moving average of new cases, and we document them by the date of the test result. So if you watch our data dashboard, and I hope that you have a chance to look that up on the King County website, there's a lot of great information there. We have to look at it by the date of test result, because that shows us in public health when the infection period, we can figure out when the infection period is and who we should be monitoring and how. But as you'll see here, after December 5th, we had a decrease. And that is a real testament to our community coming together, hearing the concerns and what was going on around the country. And now you're seeing right after the holidays, a little upsurge. And we are hoping, and you have to kind of look at this last couple of days because our data comes in over time and we have to load this in. I don't believe that that is an actual drop. So we're seeing a resurgence, but I'm hoping this will level off over the next week or so and that we don't get back up to these high levels. It's really important because when we're getting 700, that number right there on December 5th was 770 cases. When that comes in on a daily basis, it really overwhelms and risks the healthcare system. It's really next to impossible for us because there's so much transmission in the community to actually accurately try and chase back and help an employer know where the outbreak they're experiencing in their employment setting, where it started. And we're still finding the number one place that we have cases when we interview people is really from groups that are happening out in the community. It's those coming together in somebody's house or at a small event. It is people going to events, unfortunately, at their church potentially. So we're still seeing community transmission, and this is why it's so important for everybody to continue to wear their mask, to physically distance yourself. I know how hard it is for us not to gather, but we know it's just for another short period of time, and we need to hang in there together because this sustained rates is why we're at risk to our hospitals. So let me talk briefly about hospitalizations. When you have this level of cases, the percent of people that end up in the hospital goes up. And one of the problems we've had around the country is that hospitals get overrun. And that means a number of things. Number one, the death rate is higher. We have vulnerable people who are on ventilators for weeks at a time. You have individuals who are struggling because they can't visit family members. But over and beyond that, you have those frontline workers who are every day working and exposing themselves, and we're seeing more outbreaks actually in the hospital as well. Secondly, what it means is if we don't prevent our hospitals from being overrun, then we're at risk for that hospital not being ready to help somebody that's having a heart attack. This is what's happening in places like Houston right now, where individuals that are, they need treatment for cancer, they need treatment for a stroke, they need treatment for a heart attack, and the hospitals are full. I am so grateful to the hospitals who are coordinated like just amazing here in the Puget Sound, and they're supporting each other. And I checked our hospitals today, and I will say two things right now. We have capacity in the hospitals. The ICUs are not full. But the hospitals, particularly in the South End, particularly Multicare and CHI Franciscan, Valley Medical, they are seeing a large number of COVID patients. They're handling it and they're able to cope, but that's why it's so important for everybody to hang in there, because as we get through this, we need that hospital capacity so you can get the care you need if you need it. So with that, I'm going to now talk about vaccines. So I'm going to shift here and screen share the partial presentation that I gave to the County Council just this week. So, all right, so we have two vaccines. One which requires a deep freeze and you have to use it right away, and one that doesn't require that level, but both vaccines require 2 doses. Both are 95% effective. So the vaccine is being distributed throughout the country, and our state finds out 1 week at a time the number of vaccines that our state is going to receive, which means that King County finds out 1 week at a time how many vaccines we're going to receive. I make that emphasis because it's part of the challenge that isn't really obvious in the news reports you're seeing about this. But here's our goal. We have the goal to quickly and efficiently and equitably vaccinate as many people as possible of the folks that have been approved for vaccine. But we know to get to the point where what you've heard of herd immunity, or enough people receiving the vaccine so it's starting to protect the rest of us, is we need to get to 70% of all adults, because that's who's approved for the vaccine right now. So that is a goal of reaching 1.26 million people here in King County, and we want to do that in the next 6 months. The State Department of Health is the lead entity. They enroll the providers, like your physicians, who will eventually be giving vaccines to the general population. They've enrolled the hospitals. They're enrolling the pharmacies that are working with long-term care facilities. The governor, with the State Department of Health's recommendation, sets the prioritization. I get a lot of questions from people who want to know where or how can you change the prioritization at the local level? This is a state set prioritization. They distribute the vaccine. They're setting up a verification and reporting systems. So what's our role locally? We work to coordinate all of this. We work to see where the gaps are. We're the ones that are trying to find out, are there vaccines that certain providers ordered and were given but are not being used that need to be moved so we get shots in people's arms? We're tailoring information, and we're working with the community and our Black, Indigenous, and people of color, the organizations who we know need information on how to access vaccines and to get and build those trusted relationships. I really apologize for this. I know nobody can read it, but this is on the governor's website. We tailored it to put it on one slide. This shows you in one slide the different phases. So we're in phase 1A right now, which means we're vaccinating high-risk workers in the healthcare settings, high-risk first responders. Those are our emergency medical folks, the 911 responders who you count on, and long-term care facility residents. We're in the middle of vaccinating this phase. And for King County, there's about 100,000 of these healthcare workers. There's about 5,000 of the EMS personnel. And there's up to 40+ thousand folks in the long-term care settings. So that's the first priority. We know if we vaccinate these folks, you're protecting the healthcare workers so that we have the staff to help care for folks in the hospital. And we know that the folks in long-term care facilities have had the highest mortality, the highest death rate in COVID. So if we can vaccinate those folks, we know we're protecting the folks that have become the sickest and are most at risk and the most likely to die from this virus. So the governor is looking at moving into phase 1B, and we're preparing with an expectation that we're moving into 1B, I'll say within the next few weeks. Some of the very small counties have already finished 1A. With so many people to vaccinate here and with the short supply of vaccine, we're still working on that. I can tell you that I'm very proud. We have over 50% of healthcare personnel vaccinated here in King County. That's an excellent thing considering the hospitals had to ramp this up in the middle of December right before the holidays. So they're working hard. Multicare's doing an amazing job. CHI Franciscan, your hospitals in the South County with Pierce County are doing a great job. So we're looking to set up a system that I'm going to talk about so that as we finish 1A and move to 1B, which will start with people who are 70 years or older, or people who are in multi-generational households older than 50. And I'm going to caution everybody right now that the governor has been, and the federal government has been in lots of conversations, and some of these different categories are going to change. They're going to tweak. You may have seen in the newspaper just yesterday that the federal government is now recommending that this phase 1B, the first go would be people 65 and older, not 70 and older. That's just late breaking yesterday. So the governor, even though he hasn't changed his guidance yet, he is looking at whether or not. So I just need everybody to know that this is moving at a speed that these guidance do change. I work as hard as I can to keep the council member and the staff updated when these changes occur, but it is sort of moving real time. This is the most important thing, and I'll stop right after this. These are the 5 parts to our plan here in King County that we launched. It shows the different, it's called a multimodal vaccine delivery system. So as we get ready to vaccinate more and more people, we need more and more partners. It's going to take all hands on deck. And so this plan allows all the different sectors to see how they can plug in and help with all of the vaccination that needs to happen. So the healthcare system is already very involved, but they need to do more. They know it. They're going to have to vaccinate their own staff, and they're looking at ways to partner to expand that and to open up because they have so many staff that can be vaccinators so that they can help with community-based vaccinations. Pharmacies. Right now, the CDC has a program for long-term care facilities where literally a pharmacy is hooked up with a nursing home and they are getting shots in people's arms in that nursing home. That's happening right now. But other pharmacy and grocery chains are getting signed up as providers with the State Department of Health so that eventually when you get known that you're in line for your vaccine, you might be able to go to your local Safeway store and sign up for a vaccine, or your provider. We want to make it accessible in as many ways and convenient for you. Employer-based vaccination clinics. A lot of our large employers can go ahead and sponsor their own sites and bring in vendors to do the vaccinations. That's fantastic. That will get a cohort of folks that would make it easy for people. And then families can go to pharmacies or their healthcare system or other options, or maybe those employers then open it up for the families of those people if they qualify. Lots of creativity is called for here. I'm working right now with the major employers around King County who have all been like, what do I need to do to help this? Because they know that as we do this, we can reopen the economy. High volume community vaccination hubs. We know that our testing sites, which have been open access and drive-through or walk-up sites, have been very, very successful, very critical. We're looking at using that model to set up the same sort of vaccination hubs around the county. We're going to be starting with 2 vaccination sites. They will both be in South King County because South King County is where the highest level of our case count is occurring. And we can watch to see that South King County, which has a transmission rate between the Auburn area, Federal Way, up through Kent to Tukwila, can be up to 18%. So we will stand these up where the highest need is. So the first 2, we're hoping for the first one, we'll have enough vaccine for the first one by February 1st is my hope, and we will set up that first site. More to come on that as we get it solidified on where that site will be. Next are mobile vaccination teams. We know that not everybody can travel to these different sites. Homebound elderly, folks who are homeless, adult family homes, very important. So we are working with partners to set up mobile vaccination teams. We're starting again with long-term care facilities, so adult family homes. If they aren't able to get plugged into the pharmacy partnership, and South King County has the largest number of independent, family-owned or small business adult family homes in the county. again, we will be working to make sure that these mobile vaccination teams can help get the vaccine to those high-risk elderly and disabled individuals. And then I'm very excited about the concept of pop-up vaccination clinics. I've talked to schools, I've talked to health clinics, I have had reach out from employers who are like, I will host a pop-up vaccination clinic. I was at a testing site just on Monday with the new Secretary of Health here for the State Department of Health, showing him our work, and it was sponsored with a local church. And we had the associate pastor there. He was fantastic. It's the perfect place for partnerships where we brought in CHI Franciscan. We had the fire department as our vaccinators, and it was a model for the country. It was just a loving place for people to come to get testing. So we want to do that same sort of thing. And this pastor was already telling me that he was offering up Sundays, that he wanted to step up to have his parking lot to test vaccination site because he knew his congregation was interested in that. So that's the kind of partnerships that we're looking for. So with that, Councilmember, I think I'll stop here. I think I've probably gone on longer than you were hoping for, but I'm happy to answer questions.
Well, no, and thank you, Patty. I appreciate your time there. I know you're just so crazy and busy. Just a couple points, and then I'm going to get to some common questions, and so I'm sure you've heard all of these before we get to some of the more specific that have just come in over the course of this. A couple points. One, the federal government provided hundreds of millions of dollars of relief to King County through CARES Act funding, and as one of the members of the budget leadership team, we worked very, very hard to make sure that we did everything we could to sort of front load funding for vaccination distribution, and including particularly South County, that we did some things to provide outreach in a lot of different languages to a lot of different groups, and Patty was very important in the leadership of that. But I just want to remind people that we were the tip of the spear on this issue a long time ago at the beginning of last year, earlier than anyone else. We all know the Life Care Center situation. And in some ways, we're perhaps the best place in the country to have had that laid bare on us, because we have one of the best public health sectors, although are certainly underfunded. We also have one of the best private public health care facilities with Harborview and UW and our various cancer research facilities. And people probably don't know this, but King County is one of the best places in the world to have a heart attack. And I know it sounds weird to say, but with something like a 56% survival rate. By contrast, New York City is about an 8% survival rate. And what we're trying to do is use sort of our experience and leadership in those areas. And what you're hearing from Patty is really a wartime level effort of push to make sure that vaccinations are available for everyone who wants to take them. And so that's where we're trying to go. When I met with Vice President Mike Pence back early on in March, when this thing was blowing up at the beginning, I said, local governments are going to be the ones responsible for putting this out, not the federal government. So we need the tools we need to succeed. And I think back then the federal government was deer in the headlights at that time. And they've come a long way, and we've come a long way as well. Let me ask some basic questions to Patty about the vaccine. Let me first focus on the vaccine itself before we get down into distribution and other things. I think one of the questions we hear a lot is, is it healthy? What are the health risks associated with the vaccine, the allergic rate? Everybody hears these horror stories, but really, on the boots on the ground, now that we've done so many vaccinations, is it relatively safe to take?
Yeah, thank you for that, because it's such a key question that people have. And what Dr. Duchen has been really clear about, and if I can add, the great thanks to the council for all this support. And we're fortunate here in King County that Dr. Duchen is one of the most highly regarded communicable disease, infectious disease specialists in the country. So he actually has been in conversations along the way with our great researchers who have been looking at these vaccines. So he confidently looked at and felt very confident saying that the rigor that these vaccines went through in their phase 3 trials really made him feel very comfortable in their rollout, and that they were tested and really shown to be, as I said, 95% effective. Now, there are people that are allergic to certain vaccine components. That happens with vaccine. People can have an anaphylactic shock, and all providers are ready for that. If I go in and get one and I didn't know I was allergic, that's why you have to sit for 15 minutes in your provider's office. It's one of the challenges with these drive-through clinics. You have to literally have everybody go in their car and sit for 15 minutes and have medical personnel ready to help them out just in case. But it is rare, as you said. I volunteered at one of the clinics the day after Christmas, and we'll be doing so again this Saturday. And what I can say is, we saw over 100 people on that first day. The tolerance level is great. People had sore arms, and that's normal. Some people experience a little fever, a little achiness, but those are not reactions. Those are normal things the body is doing to integrate and build the immune system for us. So the rare thing are these reactions that you've read in the paper, but it is extremely rare, and we watch for it very carefully. And what I'm reading about the long-term care, the long-term effects of folks that have had COVID, even people that haven't been very ill, you've seen it in the newspaper called long haulers. COVID is not just a respiratory infection. It is actually an infection that builds in the body, and people are having long-term effects from this, and the inflammation that it creates. We saw this in young children. All of a sudden it's rare, but young children get this inflammatory disease. Well, we're now finding that adults are getting this long-term inflammatory disease that'll be studied for a long time. So when you weigh the risk and benefit of the vaccine, you have to take all that into account. But as I said, Dr. Duchen is very confident in these vaccines.
Thank you, Patty. I appreciate that response. And I agree. I mean, I don't think we're at a place where we can force people to take a vaccine in America, but I think people should take it very seriously and weigh the benefits and risks. I certainly will be taking it and encouraging my family to do so when my number gets called, and we'll get to what all that means. But rest assured, there is some allegations that some folks are jumping to the front of the line. We won't, as far as I'm concerned, we won't have anything to do with that. It doesn't matter who you are, your socioeconomic status, race, creed, color, religion, sexual orientation. Everybody's got their ticket, and when their time is up, it will be their opportunity, and nobody gets, as far as I'm concerned, an early start. Let me ask this: how long will these the Moderna and Pfizer vaccines last? Will there need to be booster shots? I mean, I know there's a second shot fairly quickly, but will there need to be booster shots in years out, 2, 3, 4?
That is a great question, and the answer to that is that they're still looking at that, when there would or if there would need to be a booster shot. And they'll have to look at each of the vaccines that are under production differently, because some of the vaccines that haven't been approved yet may be different than Pfizer or Moderna. So we don't know yet. This is a brand new vaccine, and so people will just have to wait for guidance around that.
Okay, and a question I saw pop up, but it's also on my list. These are good questions coming up in real time, but also, I mean, uh, how and when will somebody know it's that their turn to take the vaccine? I think that's the biggest question people have. One, is it safe? Okay, it's mostly safe,
Right.
worth the risk. And when do I know it's my turn? I don't want to miss my turn. I want to be there. I got to keep people healthy. All that stuff. How do we address that? How can people track that?
Yeah, that is the bottom line question, isn't it? And we
Yeah.
are working with all of our partners because I know full well there's not one way that this can be done. Now, the state of Washington is setting up Phase Finder, and your staff is going to put that link into the chat box. But I will warn everybody, I just mentioned to you that the governor may be changing some guidance imminently because of what the federal government yesterday. So this Phase Finder was just soft launched last week. And so if you go in it right now, it is still, I don't think it says under construction, but I think you should consider it under construction. And it's going to improve over time. But that's where you're going, one place you're going. Now, we are asking the state to eventually build a connection between Phase Finder and your ability to actually make an appointment. Right now, it wasn't
Great.
intended to do that. But here in King County, such a technology capital, we all expect this device to connect us with that appointment, right? So that's number one. Secondly, for those of you that are in larger systems, many of those systems like Kaiser, Swedish, I haven't checked with Multicare or CHI Franciscan, but if you're on my chart, many of those systems are already sending a message out saying, I know you want to know when you're in line and we're going to tell you. So that's another backstop. Next, we will be putting out information on the public health blog and to the media as we move through these. Not only where you can get it, but who qualifies and how to get an appointment. Because we don't want to be like what happened down in Houston, where they only had 700 doses and they had 2 miles of cars waiting of older people out in the weather. It was just crazy. I don't want to have that. So we're going to work out a way so that you can get an appointment. And then for folks who are homebound and really can't make an appointment or whatever, we're also working with the Area Agency on Aging. We're working with the disability organizations. We're working with the faith-based community to get information out. And for folks that need things translated, we're translating things thanks to the budget work that Councilmember did, things in 32 languages right now. So we're trying to do this in as many ways, and I'm sure we could be better, but we're trying to do it in as many ways as possible over time.
Great, Patty. Thanks for that response. And I will just echo that I'm going to do everything I can. If you aren't a member of my email list there at King County, Reagan.Dunn@kingcounty.gov, let's get you signed up. And I will be pressing out critical updates to alert folks about when and where these new timelines will come up and how best to click into those. A couple more questions here. We're moving right along, but questions about the timeline, really. We do hear these stories about the vaccine sitting on shelves and not being used. Why, without pointing blame or anything, there's no time and room for that, but why are the vaccine rollouts taking so long generally across the country? And are we on track to complete phase 1B vaccinations, which you talked about by the end of January?
Yeah. Such a lot in the media on that. It's hard to contextualize what is really in King County, what's a regional issue, what's a state issue. So let me put it in this context for you. One of the major barriers to getting vaccines out is that the federal government, as I said before, has only been telling states on a weekly basis what their allocation is. And in that way, it makes it really hard to plan events, to plan how to get it out to the right places. Secondly, because of that, and because Public Health Seattle-King County only finds out on a weekly basis what the state is going to be sending in, we have not, it's not been transparent, nobody's fault, but it's not been transparent where all the doses went. And so if we know that, I don't know, make it up, Swedish is doing a big site and they could use more doses, we don't have the ability to help move doses where we know they could be used. So we have a commitment from the state to help us so that, because we have a better sense of where that is. And I know that there are some practices that signed up right away, but then realized they didn't have the infrastructure to actually get the shots out, and we need to move those vaccines around. So that's number two. The third thing is the pharmacy partnership that was set up on the federal level. The state has had no influence on that at all, and there's a lot of pressure right now that the governor is putting on that partnership, because some of those appointments with some of those nursing homes were out in March, and that is not acceptable to me. I just really was upset when I heard that, because if we want to get to that very vulnerable population right now, we need to get her done. And so I'm hoping we broke the logjam there this week. That'll really help. So you can see that all those things, the other thing is, the manufacturers, both Pfizer and Moderna, have had a supply chain problem. Pfizer, I'm sure you all saw this in December, Pfizer put out an estimate of what they were going to ship, and it was cut by like 40% right away. Not from anybody's fault, but when they finally realized what their distribution system was, it wasn't going to be able to keep up with that. So we're going to have supply chains. It's a brand new drug. There's only one manufacturer of each, it's Moderna or Pfizer. They're limited to their production. As we all know, manufacturers only have so much production capacity, so they can only push so much through. So it's complicated. That's no excuse for not getting shots in people's arms, but that's a situation we're trying to solve all those things.
And just like personal protection equipment, I mean, we had this crazy shortage of that.
That was terrible.
Yeah, and I'm loath to throw anybody under the bus, but if there is somebody to point to, the federal government was caught off guard and did not take the right steps early on to do what they needed to do. Thankfully, we have a very strong local response, but we're still limited by supply issues. And so let me ask them now. We got about 15 minutes left here. I've got some very specific questions that I want to ask, because I think these are good ones. And this is from one of the folks here on the call, Patty. And I don't have the names, but I'll read the question. How can a 66-year-old guy protect his spouse who is 60 if only one of us gets the vaccine? Is there a way to get the vaccine together in these circumstances?
So that right there is a perfect example, and thank you for asking that question, of why the governor is rethinking of these phases thing. He tried to address that by saying that people who, and again, this benchmark of 70 was set at the federal level, 70-year-olds, or if you were 50 in a multi-generational household, or you had that we would accommodate that. So that was an attempt to address what you're talking about. But this issue of a spouse and another spouse, no matter when we make vaccine available, we're going to have to be very protective of ourselves and limit, especially if you're at a vulnerable age, if you have a condition, limit your outdoor activity, continue to, if you can have groceries delivered, other strategies to limit your exposure, do that. But this is what public health is so dynamically trying to work on with the State Department of Health and give feedback to our congressional delegation that's trying to feed the administration to like get real and think about the real life situation people are living in. I myself live, my husband's 74. So I really appreciate that question because I'm quite a bit younger than that. I hope you can tell. And so I understand the stress of what you're saying.
Okay, thanks for that response. Another question is, when will mobile clinics that serve homebound elderly be available? How can people sign up?
Yeah, so we are working with the Area Agency on Aging right now to try and get a sense, and with the state of Washington, which is the Department of Social and Health Services, on how many there of those folks we have in King County, and who their caregivers are, if that's family members, unpaid family members, paid family members, or a visiting nurse or whatever. And then we are building partnerships with emergency medical, with the community health centers that have mobile teams, with our own mobile strategies. We have a small mobile group in public health so that we can get that launched. Our hope is that we're launching our mobile teams for both the adult family homes first, again, in that 1A where that critical group that lives in a congregate setting, we're starting there. And then as we move into phase 1B and go for either those who are either 65 if the guidance change or 70, we'll be moving that out. But we're really interested, and Councilmember, this is a great partnership we can have. As you hear from folks in that situation, that's great information for my team to get, because I'm sure that
Great.
the information from the state will have gaps in it.
Yeah, I certainly appreciate that, and thanks for that response. Here's another one. I'm 71 years old. I live in North King County. It sounds like we're being cut out. Can I drive to South King County to be vaccinated?
Well, you are not going to be cut out. Absolutely not. All the strategies that I talked about are going to be deployed around the whole county. And we are going to be working fast to expand this as soon as we know we have the vaccine allocation. So the starting in South King County, because our rates are so high there, I hope the folks on the call understand that risk. We won't turn anybody away. If folks make an appointment and come from North King County, we're not trying to ace anybody out, but we know that the infection rate down in South King County is just so much higher than the rest of the county for a whole bunch of reasons. And so we're starting there, but we're going to deploy these resources all over the county as fast as we can.
Thanks, Patty. A few more questions here. And I'm not sure if this is still accurate, but other Washington counties have started taking reservations for 1B vaccinations. And the question goes, why hasn't King County? I'm not sure if is that true or not?
So I'm sure you've heard that. I was just on a call with all local health at noon today with the new Secretary of Health, because many of the very small, here's another distribution problem, many of the small jurisdictions, Asotin County, the very small counties, Tri-County up in Northeast Washington, I think that Skamania County down south, they have finished 1A. Mm-hmm. But they didn't have very many providers to begin with. And what we found out is DOH gave them an allocation that proportionally to what they gave King County didn't fit. I mean, they were given enough to do all of 1A all at once and get it out, and we were not. So we haven't started taking reservations for 1B because we've been concentrating on 1A and all of these gaps that I described and trying to get our partners aligned. We're a very big county, and I have a commitment from the new Secretary of Health to work closely with our elected officials and to really address the infrastructure needs that we've got here, being the metro. We are the metro. We're 30% of the state here. And so we are working to make sure that we are treated as such. So.
Well, thanks, Patty. We're also the most densely populated county, and that goes to transmission rates, as Patty knows well. Here's another question: is the state continually getting more vaccine shipments, or is there a lull right now, or is it sort of constant?
The numbers vary week to week,
Mm-hmm.
which is driving the state crazy. But there is flow every week, and that's really good news. And one of the things that has happened is some of the large systems, and when I say systems, I mean those hospital systems that have the deep freezers that can take the Pfizer vaccine. They have timed their orders to make sure that those vaccines, they shouldn't be sitting for weeks at a time. So people may have heard that maybe some healthcare system had not received an order in a week, and it's likely that they either didn't order for that week or DOH was staging the orders. This is part of the transparency I'm hoping as we move further into the new year that we get a better sense on locally so we can help.
Okay, great. Thanks, Patty. Three more questions I think are appropriate, and then we'll probably wrap up. According to find your phase B2 includes grocery store workers. And here's a good question: does this include mom and pop convenience stores too?
You know, it certainly does when you're doing that direct interface. So the interesting thing about grocery stores that I've talked to the big guys about is they need to look at this from who is actually interfacing a lot with the public. That's what we're talking about. Those folks that are putting themselves at risk. So clearly the idea of that mom and pop, that small business that is dealing all the time, we're in dynamic conversations to make sure that these phases are treating people equitably, because we have a lot of great small businesses here in King County that have worked really hard to stay open, and the small grocery stores in areas where people count on those grocery stores. Those essential workers have been risking themselves throughout the whole pandemic, haven't they? And so I'd like to hear about that if there's a glitch or a problem on that, because we clearly need to protect our small businesses who are we count on for groceries and critical services. Absolutely.
Okay, thank you. Another interesting question, Patty, and you're being a great sport answering these. Is one vaccine better than the other? Or is the only difference between the two the storage difference? How would you respond to that?
Yeah, I get that question a lot. It's a great question. They're both developed in the same way. They're a new technology that means that they don't have to take the virus and sort of smoosh it up and give you either live or dead virus. There's a real advantage to that. So they both use this new technology, so they're both about the same. It's just that their manufacturing, one had to be deep frozen and the other didn't. I believe that in the future we'll see another vaccine that may only require one dose. Whether or not it's as effective as the two we have right now, we'll wait and see. But I'm sure everybody on the call, if they had the opportunity to only get one shot rather than having to go back and get the second one, would want that. And I don't know when that will happen or how effective it'll be or anything, but that's the truth right now. Okay,
that's good. Yeah, I think if I had an option, I would just take whatever I could get my
Just take whatever, that's right. Whatever your provider has, that'll be just great.
I could. This is a good question. I know the answer to this. I know what you're going to say, but I like to, because I just read it today, but it's a great question. If you think, I think, here's what they say. I think I got COVID in early March, but never got tested. Should I take the vaccine anyway?
Well, certainly, we really have no idea how long after, even if you did have COVID, how long you're protected. You've seen in the news that there have been a number of cases around even this country where someone who had COVID got it again. And so you can't count on just having COVID giving you the level of immunity that the vaccine can do for you. So you need to talk to your provider for sure about that. But back in March, that's a long time ago. And I'm pretty confident Dr. Duchen would recommend that when you're ready, that you talk to your provider about getting in line.
Perfect. And finally, I'm going to add one more. I saw Johnson & Johnson is also working on. Is there any indication we're going to get, in addition to the 2 that have already been approved, more vaccines? Obviously, and I asked you this question at committee here a couple weeks ago, but more vaccines, more options are better. That's better than less vaccines and less options. Are we hearing that there'll be additional Johnson & Johnson or other companies around the country or the world that are going to come through with vaccines?
Yeah, Dr. Duchen has talked about the potential. I think it's 3 that are in production right now. What he doesn't know is, I think only one of them, and I think it is the Johnson & Johnson one, that it has begun phase 3 trials. So the phase 3 trials takes a number of months because they've got to get a large enough group to make sure they know what the effectiveness and the safety is before they can ever go to the FDA. It would be great if one of these within the next 3 months finished that phase 3 trial, went to the FDA, got the analysis, so that when we get closer to opening it wider to the wider population, that we had another choice. That would be ideal, and everybody can keep their fingers crossed for that.
Thank you, Patty. Great dialogue, and I sure appreciate your answering these questions and your leadership on this. I saw so many really good questions. I think that it's important to note that I'm getting the sense from our federal lobbyists back in Washington, D.C., that there will likely be additional COVID CARES Act-like funding coming from the federal government. And that the basic idea is that, look, we've invested in this strategy for the last nearly year. We're at or near the height, I pray, of the pandemic, and that it makes sense to continue to fund through this until people in the community get healthy, and then we can talk about tightening the federal government's budget once we have done that. And I want to commit to my constituents that I see nothing really more important than the physical health of our community and our constituency, and that I will do everything in my power to ensure that the funding that comes through King County and is appropriated by the county council is done so with a dramatic and first priority level look at making sure that we get our community vaccinated and healthy and back on their feet as soon as we can. When we do that, studies have shown, even in the 1918 pandemic, that the cities that locked down the hardest, that have practiced social distancing, got their communities healthy, were the first communities to come back out of the recession and gain traction. Businesses began to open. So we have a healthy community. We're going to push on that. We're going to get these businesses back open. And then there's another part of this. We got to take care of those businesses that are hurting, get them back up on their feet. We have things like eviction moratoriums that expire. We got to give folks the money they need to make sure that they don't lose their homes. So there's a global set of issues that we need to fund. And I just, this is the issue of a generation, the most significant issue of a generation, if not beyond that, at least at the local level. And so it is a wartime level effort. You have my commitment. I know Patty feels the same way, and my council, whether you happen to be a Republican, Democrat, independent, nonpartisan, doesn't matter. We're all pushing in the same way. And while government will make mistakes, it is as fallible as any other organizations around the world. We are doing our very best. And I would tell you this, I'd much rather be in the greater Seattle area than many communities across the country. And so know that it is the most issue close to our heart. We live it, breathe it, wake it, and think about it. And just know that we are doing what we can. So you can certainly reach out to Patty Hayes. You can reach out to my office. And I just want to thank you for participating. We had well over 100 people on this call, and that was great. Patty, did you have anything else you wanted to add to this?
I just want to thank you, Councilmember, for your steadfastness throughout this, your voice, and your continued support, and the hard questions when you call me. It's all really much appreciated. And thanks to all your constituents. as hanging together as a community. We're going to get through this together.
We will.
So mask up, social distance, small groups.
All groups. And also know back in your heart, every generation of Americans has gone through something tough. We're going to get through this, as tough as it is. And we will succeed as Americans. So, Patty, if I might, maybe we can do another one of these in a period of time when we.
Very happy to do it.
That would be great, because this is where the rubber meets the road. And folks, for you who have participated today, please pass these on to your friends and family, this information, and mask up. And we're going to do everything we can to make these vaccines available to you as soon as we possibly can. So with that, I want to thank everyone for participating. I hope you have a great night, and stay safe and healthy.